As we've been sharing with you this morning, the World Health Organization is now reporting the largest single-day increase in coronavirus cases, with more than 183,000 added to the global total in one day. With the pandemic now more than 100 days old, we're at 100 days, it's a different Canada than the one we lived in a month ago. Restrictions are being eased across the country, with people able to dine out, go to the beach, get a haircut in many places. With more, we're joined by infectious disease specialist Dr. Bogoch. You know, I was watching you in the screen, Dr. Bogoch, and when I said that about the reopening, you kind of shook your head a little bit. So let's take a look at the rate of COVID-19 reproduction and how it's changed in Canada. In early March, if you had COVID-19, on average, you infected close to 4 other people. Well, now it's not even 1. So what does that tell us about how we have controlled the spread of the virus so far?
In general, across the country, we've done extraordinarily well. Some places did better than others early on, but I think the rest of the country has caught up. That reproduction number is a very valuable number. We know that if it's less than 1, our rates are going to continue to decline, and that's obviously the right direction to go into. The key thing here is we cannot get complacent. Even though some of these economies are opening up, even though we're seeing a lifting of some of the public health restrictions someplace, we still have to practice physical distancing. We should still be vigilant about hand hygiene. If we're going into an inside area where we can't practice physical distancing, we should be putting on a mask so we can keep that R number down and keep our rates of infection down in the country.
So the same rules that we practiced at the beginning of March, keep them in place now. Speaking of the spring, from mid-April to early May, Canada was seeing more than 1,500 new cases of the virus every day, with a peak of more than 2,500. So we've seen now fewer than 500 for nearly 2 weeks straight. Is a rise in the number of new cases inevitable as we start the reopening process?
It might be. I mean, no one would be alarmed or surprised. Let me rephrase that. No one would be surprised if we saw a rise in the number of new cases. As people mingle together, we probably will see some increased transmission. And we know that this infection is very contagious. If you're in an indoor environment and you're close to someone who has this infection, you're going to transmit it. So we just have to be extremely careful. It is helpful that it's summer and people will be outside more and more. I'm a little more concerned about the fall and the winter when we're clustered together indoors. If we don't have a vaccine in place by then, which it probably might not, we may see further transmission. So we've got to be very careful with the lifting of the public health restrictions. And of course, we have to be very careful to adhere to our public health recommendations so we can keep those numbers low. Because as you pointed out earlier, even though we're doing well in Canada, the rest of the world is unfortunately doing terribly.
Like you, Dr. Bogoch, and obviously not as closely and not with as much expertise, but we've sort of been keeping track of the cases and where they land. So now China is putting in restrictions again. New Zealand has new cases. They're putting in restrictions again. Given the fact that China was 3 months ahead of us in the last bout, and there's a lot of talk of second wave, is it possible that that's where we're heading here in Canada?
Oh, absolutely. I think that nowhere on earth is immune to having a second wave. This is certainly a possibility. And essentially, we know how to prevent it. We know what to do. We've been through this before, just like almost every other country on the planet. We know what the playbook is now. We can prevent this from happening. If it does happen, we can blunt it. It's a matter of having good policy, adhering to that good policy. So that's at a government level, and then at an individual level, it's just vigilance to adhere to these tried and tested methods of prevention, such as physical distancing, hand hygiene, mask wearing when you're close to some other individuals in an indoor setting. Those are the key things. And if we really do that, we can prevent a second wave. We need good policy and adherence to that good policy over time. We should do okay.
School might be out for summer, but still keep practicing all the lessons we've learned around COVID-19. Dr. Bogoch, always good to talk to you.
Great to chat with you as well.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.